So a lot of people have wondered, why is it so difficult to test for the COVID-19 virus? What is different about this virus than other viruses that we diagnose on a daily basis? First of all, this is a brand new virus. We'd not seen it before until it was discovered in China in 2019. After it was first discovered, we had to develop tests that could actually detect the virus, and then those had to be mass-produced to be able to test in cities and states around the country. Initially, the Centers for Disease Control really controlled all of the testing kits, and they've only really distributed those to the health departments. So in order to try to solve the dilemma that we're having with testing, HCA, both at the national level as well as at our local division and hospital levels, are working with all of our partners in laboratory diagnostic testing to try to find out what do these commercial labs have to offer us. In some cases, they are actually going through emergency usage approvals by the FDA to get some of their newer testing approved. And once those are done, we'll be able to bring them into our hospitals and be able to get a much faster turnaround time than what we currently have. So some patients and doctors feel that they should be able to go to the hospital in order to get testing for COVID-19. First of all, if you're not sick enough to be hospitalized, we really don't need you to come into the hospital. And second of all, there are much better testing options that are going to be available very shortly, namely drive-through testing centers where you don't actually have to get out of your car. You just pull up, someone gets some samples from your nose and throat, and then you're done, you go home, and then you'll get alerted to what the results were by either email, phone call, or text.